Yeah.
All right, we're 2 past the hour. Let's kick things off. And welcome to the webinar. There's the camera right up there, camera one right there. So welcome to the webinar. I'm your genial host, Jeff Beglin from Cornerstone. And also on the call is my friend and colleague, Brad Petrella. Say hello, Brad.
Hello, Brad.
And today we're joined by Chris Jaquis of Antidote. And we're so thrilled that he could join us today in person to talk about Antidote. Is a new player on the ACA platform now, and we want to talk about their plan options. And before we do that, I just got a little housekeeping to do. You know, if you have a question, and you certainly will, let's put them in the question box, and we'll get to them throughout the presentation. We won't just wait till the end. So we're going to get to those questions as we go. So as we go, let's do the questions. And then here we are. So there's our contact information. We are now both business development managers, so I'll update my screen. But Brad is handling Northern Ohio, Northeast Ohio, the Cleveland area, and those environs. There's his phone number, his email address, and by all means, you can also reach out to me. I handle Columbus and below, Southern Ohio, basically, and the I-75 corridor. But you can certainly reach out to me as well with all your questions. I know we're in the busy season right now, getting ramped up for OEP, and so much news coming down the line, and we're on top of it, and we are your ally. So I'm going to let Brad introduce Chris and talk a little more about Antidote. Can you go take it away? Thanks, Brad.
I can. Good morning, everybody, and I'm going to maybe try and stretch a wee little bit because we keep getting more and more people joining, and we have, thankfully, a really big RSVP list, so I want to give everybody a chance. But so some of you may know, because I saw some of you on the RSVP list yesterday from the in-person training at the Aviator Restaurant in the Cleveland area. You're going to be really happy with what you hear Chris talk about today. Simplified, on exchange, that's the biggest thing, gang, and that's really exciting. So we have, a new player, and I think you're going to be happy. I'm not going to give anything away. It's Chris's show, but I really, everybody that was there last night or yesterday afternoon was really pleased with what they heard. I saw a lot of heads nodding positively, favorably, and a lot of smiles and a lot of engagement after Chris's presentation. So, just listen, look. If raise your hand. I think there's a raise your hand button someplace. If you need us to go back or slow down, just do it, because I want you guys to see this. This presentation, as always, is going to be recorded, so you can go back and listen to it if you like. But we're also going to send out a PDF version of this presentation. I will tell you that some of the slides are a little bit small from my past experience. When they're created on a PowerPoint presentation on your laptop, they look massive. But otherwise, they're not really. So just pay attention. If you need us to slow down, let us know, and we will. And we've gotten more people, so I am not good at stretching. I don't know any really good jokes. I might forget the punchline. So if anybody knows one, type it in. But I'm seeing a lot of people. So I tell you what, why don't we go ahead and get started? We're now 6 past the hour. Respect everybody's time. Those that didn't join, they'll be on their own to find the recording. So, Chris, I'm going to go off camera and mute my phone so we have some bandwidth. And Chris, take it away. Welcome to Ohio, 2 cities in one day. And I don't know if he got his ice cream last night on the way to Cincinnati.
Didn't make it.
Bummer. I got some out of my freezer. All right.
Good morning, everyone. So we're going to go through the training, and as Jeff and Brad have both said, please raise your hand, please send your chat. We'll try and make it as conversational as possible. I am going to need to see the slide though, Brad. So I'm going to start with who we are. I know a lot of you have met us, and I appreciate it, and I want to tell you the relationship with Cornerstone will always be near and dear to our hearts here at Antidote. We're really appreciative. As many as you know, last year we tried to roll out. We really only wanted to have one or two large GA IMO groups. Unfortunately, we're not able to do that this year because we lost last year. But the relationship with Cornerstone is something you need to know. You're the only agency that we're working with that is really, truly boots on the ground, feet in Ohio. Everyone else is the large IMOs who are in, however they're recruiting, call centers and things of that nature. We really think that the in-person relationships that the Cornerstone brokers have mean a lot to us. And we also know our plan is new, and that explanation is actually very important. So with that, if we could just roll up, Brad. So we have a quick agenda. We won't spend a lot of time here. Obviously, this is what we're going to go through. Give you some of our history and who we are. We can keep going down through. So get to know us. We do have a video. Unfortunately, the firewall does not play, but many of you may or may not know that Yanis Yakatetempo is our investor and ambassador to Antidote. His growing up basically as a refugee in Greece is an amazing story. He truly believes that healthcare should be affordable and accessible to everyone. And that is something we at our team, we believe in and preach every day. So I just want to introduce that. The video won't play because of the firewall, but please, when you get this deck available to you, take a look and a listen. It's 4.5 minutes of a really inspiring story. So our background, for those of you who don't know, our founders are from Israel. They've moved here to the United States. They had a plan. They wanted to create a virtual HMO. They do have health insurance background in Israel. They came to the United States. And of course, to create a virtual HMO, you just can't do that if you don't have thought and decision process created. So we created a telehealth organization, which we started in 2019, 2020. I was almost at 1919. Oh, 2019, in 2019 and 2020, which we actually capture all of the data. Everything that comes in, we capture all that data and we're tracking it. And we're going to be using AI to really support decision support for our physicians and a virtual care path for our members. And you're going to hear me mention the virtual care path throughout the presentation, but that is something to remember. That's how we're feeding that. We see roughly 50,000 patients a year. And we've developed what we consider to be a payvider model where we have our own physician group that is part of the team. So again, I mentioned this already, our mission. We really believe basic healthcare is a basic human right. We believe everyone should have access to quality, affordable healthcare. We're very excited by that. And we do believe that we're transforming healthcare and making a positive impact. Obviously, we have a virtual first model and we have some advanced technologies. And the cool thing about the negative part about not being up and running last year was we weren't up and running and we didn't get full access to membership here in Ohio. The positive takeaway, putting a positive spin on it, we spent the last year honing and cleaning up some of our services, and we'll talk about that today. What makes us different? Why are we different? We don't want to be the typical health plan experience, which is limited by geography, virtual care, is different in those models. Jeff sent us a note. I don't know how to fix it. Or Brad sent us a note, Jeff.
So take a look at your slide up the right-hand corner.
Are we still here?
Yeah, you're still here. Go in the upper right-hand corner of your PDF. Next, to the left of the cogwheel, there is a expand arrow button. That one. It'll make it easier for everybody to see. I just noticed.
Thank you.
Carry on. Yep.
Thank you, Brad.
Yep.
So we don't want the typical health plan experience. We don't want geography to limit you. So one of the things you need to know, you have local providers within your space. So that still exists, obviously. But if you're traveling throughout the Antidote Health Plan of Ohio, and you're going to learn Arizona later on in the presentation, Any provider in our network is open. The only limitation by geography is to where the network is available to be sold, that the plan is to be able to sold. Virtual care, obviously we think it's very important that, we're not a one-time care, just stop in and shop. We're not urgent care. We actually have primary care physicians. And so I think that's very important, and we'll talk about that. We don't expect it to be a stopgap. We expect it to be care, ongoing care. It's a practice. So if I go see Dr. Jeff in his office, and I see Dr. Jeff, thank you for completing your med degree, they're not 5-minute stretch. Jeff becomes my doctor. Virtual healthcare, I call, I have Dr. Jeff, he is my doctor. If I call and Jeff's not working, I see someone in Dr. Jeff's practice, just like you would in your bricks and mortar practice. So we'll talk about that as we move through. And again, the silos of health data. As you know, you go to one doctor, you go to another clinic, you go somewhere here. We're going to use technology to break that down. We're going to work with our members to get access to their health care, use AI to really, again, to review what's going on with our members so that we can create that care path for our members that creates better health care.
Okay, I just want to jump in real quick. One question was they're having difficulty with the sound. If you could please, if you're hearing this, if you could please put a question in the question box, or just a comment in the question box that you're hearing this. Okay, we're having issues with the sound. I apologize for that.
That was
wonderful. Thanks, Ty. That was concerning me a little bit. Okay, great.
So why are our plans different? So first off, virtual care is always available, and we offer virtual care with every plan. So that's a very important piece to recognize. Mm-hmm. Our virtual care is available in 22 states, so you're not limited to where you see your doctor. Your virtual care provider can see you in 22 different states if you're traveling. Bricks and mortar, just like every other ACA provider and HMO provider, you're going to be limited to where you go. But virtual care is everywhere, and it's always available. Each member is assigned a virtual PCP. You always have the option to change. So if I call, Dr. Jeff becomes my doctor, and we don't hit it off, and then one day I get Dr. Brad, and I'm like, I want to make Dr. Brad my PCP. I can do that. That's allowable. Male, female, things of that nature, just so you know. We expect to be used for primary care. Obviously, you would have access to urgent care as well, and or chronic conditions, which we'll talk about. Most of your virtual appointments will be with your virtual PCP or someone within the practice. Our PCPs have access to members' medical records. Again, we're gonna have a medical record by seeing your virtual PCP. They're gonna track your history. So I went to see Jeff, and he said, Chris, we talked to you on Monday, and you're taking an antibiotic. But I come in, and Jeff's not available, and I see Dr. Brad. Dr. Brad isn't gonna go, never seen you before, never heard of you before, don't know who you are. Dr. Brad's gonna go, look at my medical record and go, you just saw Dr. Jeff last week, you've got some other history here you've reported, let's do this, let's make a change. And I think that's very important. On average, our appointments are available in less than 20 minutes. And then members can always use their provider app. Now, I put my phone down because I always forget about this, but you guys will want to see this. And if you get to see me anywhere in person, let me know if I'm around you at any point. I would love to show you all the app. And I'm actually getting yelled at on the app because I requested an appointment last night and didn't go. So but we have an app that you can use. It's very easy. So just so you know, I didn't show up for an appointment. I'm getting asked if I need to see the clinician. Is it still urgent? But the app is wonderful and easy to use. So again, we'll highlight this. We'll say this over and over and over again. Easy access, lower cost, because $0 visits any time for our members virtually, and convenience. I use my own care experience. I was in Arizona about 3 weeks ago, one of our states. I got off the plane. I felt bad. I felt really, really ill. I went on the app. I requested an appointment. Literally, I got my appointment. I pulled off the side of the road, my rental car. I took my appointment in my rental car, private, which was great. Saw the doctor. She asked me where I was staying. We coordinated. She sent my prescription to the Walgreens next door to my hotel. I went back to the hotel, took my medicines, canceled my meetings. The next morning, I woke up, back at it live in person. It doesn't get more convenient than that. You know, it was really easy and a wonderful experience. I think That's something that we all want to experience, right? That's the other nightmare for me would have been to go to a virtual care, sit in a waiting room, be seen by someone I don't know, and figure that out. Not what I was looking for. So it was actually a wonderful experience. Why do we do this? Again, here we go. Improved better experience, improved health outcomes, and greater adherence to treatment plans. If we have a virtual provider who you can talk to at any time, we know that we're going to be able to communicate with you and help you follow that treatment plan. It's more than virtual care, though, and that's the important piece to know about our plans. Because we are a QHP, you have the option for virtual care because we're a virtual first HMO. You can go in person, and you're going to see 4 Tier 1 providers. I will tell you that as of right now, we don't have any Tier 2 providers. So that's a contractual thing that we've built in that may happen in the future that will be identified in our provider directory. And we'll come back to that. I'm sure there'll be some questions around that more in the future because it's non-existent today. And then we also think what is a wonderful model, and I'm going to show you some of the experience, is that blended care. Start with virtual. They're going to talk to them. There are things that your virtual provider cannot do, and then they're going to refer you to an in-person or a bricks and mortar physician. And then when you use your virtual care, you get $0 PCP or reduced copays and deductibles for your specialist. And that's the heart of our plan as we talk about it. So here we go. We'll jump right into it for everybody. I'm going quick because we only have an hour and I want to open up for questions. So here's the new stuff. Exciting. The light blue represents where we were last year. You'll see 1 county missing. Belmont is not on the list this year. Sadly, just couldn't get network adequacy in Belmont County. But the dark blue are our new counties, so 43. We're continually looking to grow our network. We always are working on that. We actually now have a network development team who's out continually recruiting providers. You'll also see in Arizona, and I love this fact for those of you who aren't from Arizona, we have 2 counties. So Arizona represents about 9 million people. In these 2 counties, there's roughly over 5.5 to 6 million people. So we're in Arizona. For everybody who knows, if you're licensed in Arizona, we'd love to have you go ahead and sign up and be appointed there. Our products at a glance, just to keep it simple. In Arizona, we will have individual and family. We will have small group, and we will have off-exchange ICHRA as we have. The only difference here in Ohio, we watched the market. We spoke to the different stakeholders in the market. We will not be offering small group. It just doesn't seem to be an equitable solution for us at this time. Obviously, larger, older plan, competition, network, and rates, et cetera, it just doesn't financially work for us. So it'll only be individual and family and ICHRA. Our ICHRA plans, oddly enough, it's the majority of our membership now. So it's actually, we find that it's really working out well, and we're very excited. So that is available. Our basic plan features, just so everyone knows, $0 PCP visits, 12 visits a year, once a month, go to see your PCP, get healthy. Identical plan options. So I will say my friends at Cornerstone asked me for less. It's more simple, not more plans, don't confuse us. We added dental. So there's, for every matching plan in bronze, silver, and gold, there's a matching plan with dental, with or without dental. Now, one of the things that happened last year, and this is actually something I want you to hear because I don't know if my favorite broker's on or not, and I won't call her out today, but we had a broker reach out to us and call me and say, Chris, my member is telling me he needs a referral. HMOs don't do that anymore. Are you guys really still requiring referrals? And I said, driving down the road in Arizona, I said to her, yes, we do. We're an HMO. She's like, that's really not a good thing. You guys should reconsider that. Oddly enough, I had been in a meeting a day before where someone else had referenced that. We had a conversation. I pulled over, called our leadership team. We called an emergency meeting 2 hours later, sitting in a parking lot at one of your competitors, Health Markets, sitting in their park. And I only remember because I'm looking at their giant sign. And I was sitting there, and we made a decision that we got rid of prior authorizations and referrals. And that really was based on broker feedback. So when I say the reduction in prior authorization and referrals, just let me tell you what that means. So referrals, you don't need a referral to a specialist. You don't need a prior auth to go to a specialist. Now, if you see that specialist and they want to cut you open, you'll need a prior auth, right? If they're going to do a procedure, they'll need a prior auth. So we haven't eliminated that. We're still obviously monitoring and managing healthcare. but we wanted to make it easier for folks to get to their specialists. Does that make sense? Yeah. Okay. When you go virtual first, these are the added benefits of the plan. Unlimited $0 Antidote virtual visits. So it's not a limit of 12. You can call your virtual doctor twice a week. That's okay. It's free. We do have chronic care for diabetes, mental health, and hypertension. We'll talk a little bit about those in a second. There's an additional maternity benefit, $0 OB office visits when you start with a virtual care path. The question last night that we heard was, so if I come over to your plan and I'm pregnant, do I need to call you first to go to the OB? Well, call us first. Continuity of care is going to be in. We're going to say, go to your OB. You know, continuity care is a reality. $0 copay for generic drugs when you're referred by your Antidote provider, and reduced copays, PCPs, and specialist visits when referred by your Antidote virtual provider. So those are things to think about. Last year, we made a joke of it. We kind of had fun with it. When in doubt, use your app. When in doubt, use the app. That still holds true. It's not, you know, that's kind of a mantra. Our plan names for this year, a little different than last year. We did try and simplify the plan names. Complete and Elite. Real simple. The Elite's got a little bit of a richer plan option. So $0 core RX is available in your Complete plans. You have a $0 advanced prescription plan available with your Elite. You have co-pays for your labs, not co-insurance, co-pays, so flat rate services, and you have co-pay for your PT, OT, and ST. So that's a little bit different, a little bit known spending. You know, we think about this, and I failed to say this. One of our core tenets that we're trying to do is folks pay a premium for healthcare, right? Every month they pay their premium. They shouldn't have to pay for basic healthcare. We think it should be $0. We think it should be inexpensive. Dollars and cents should not be a deterrent to go to the doctor. You pay for healthcare. That's why you have insurance. But yet, I'm sure if I said to you, show a raise of hands, who hasn't gone to the doctor because they're going to have a copay or deductible? A lot of you, even as agents in the room who know the business, are going to raise your hand and go, I didn't go because it cost me money, right? And that we don't want that to be a deterrent to care. It's really important for us as an organization. How your plan can be used. So this is really how it works. Again, this number one, I'm not going to spend a lot of time on that. I told you about my situation in Arizona. That's exactly it. It's exactly how it happened, except she was able to call it in to where I was in one of my states. Now, I live in Pennsylvania. It was wonderful, and I have the telehealth app. The mixed or that kind of virtual path that we talked about, number two, you call your Antidote virtual PCP, you have a conversation, they discuss with you what's going on. You probably need to go get that lesion looked at. You need to go look at that mole. It's not asymmetrical. You need to go get it looked at by a derm. We get you referred to a derm. You get a referral specialist deduction, $0. You see your derm. Might be a $4 copay based on your plan and benefit level and selection. Get a prescription. Then you pick up your prescription, $0 generic. You know, that's how that works. We expect that to be hopefully 2 to 3 weeks max. We're in the real world. This is it right here, right? Except for now bricks and mortar. This is our plan. You can see your PCP, $0. You can go see your PCP and refer to your derm, still $0. Then you get that call. It's a 1 week out, might be one more than that, and then you're going to have your copays, and you'll see it's higher. This is actually the bricks and mortar path for the plan, right? This is our plan. We have another version of this that we show, which is what real life, and this bottom line actually represents over 2 months of care, which we don't want, right? We're really opposed to that. Network. I knew that question was coming. So this is our Arizona network that we're showing you right here. Clearly, we are completing contracts because we're brand new there. But for those of you in Arizona, the Arizona Care Network really represents the Phoenix market. Honor Health would be in Scottsdale. Carondelet, Tucson Medical Center are obviously down in Pima County in Tucson. And then Commonwealth, ASPA are all over the state. Valleywise is comparably, they would be like a Metro Health, but they have really great quality scores and ratings, which is amazing. So they are the safety net hospital in Maricopa County, and Sonora Quest Labs down in Arizona. We will be bringing Quest Labs here. They're not in our network yet here in Ohio. Here is the Ohio network. So we lease or rent or access our network, however you want to refer to it, through a group called Quality Care Partners. If you don't know Quality Care Partners, they're based in Zanesville, Ohio. Fabulous group. They know the market really well. Over 25, almost 28,000 providers throughout the state of Ohio. But we access our network via Quality Care providers, and all the providers in the Quality Care network are in our network. So I just want to say that again. We lease our network from Quality Care Partners, and all providers in the Quality Care network are our providers. I'm letting it sink in. It's a moment for a long pause. Again, emphasis on all providers in the Quality Care Partners network are our providers. So
Chris,
we mentioned chronic conditions.
Chris, let me go back. Go back a slide, Jeff, please. So anyway, so many of, Chris is not allowed to say it because of legal reasons. I could say it as an advisor. There may be a glaring omission here. Just know that that glaring omission is in the QCP network. So I said it legally correct. So when you do a provider search via Antidote's platform, which goes to Quality Care Partners, you will see who you want to see in Northeast Ohio. Okay, so look at that. Chris, I don't know if you're going to show an example of how you get, like you did in person last night, how you get to the provider network. So save it for later.
I'll show the link. I'll show the link, Brad, later. Thank you. Yep.
Okay, cool. Yep, thanks.
You got it. So thank you, Brad, for that, by the way. Chronic conditions, we mentioned this earlier briefly. We have chronic condition care. We think it's really important, again, I'm going to emphasize that point, that everyday healthcare should not break the bank, nor should be, what's the word I'm looking for? I went blank, I say it all the time. Shouldn't be a reason you don't get healthcare, right? Cost should not be it. We know, studies say, people are spending $400 to $600 a month on insulin with copays and deductibles. That's ridiculous. We think it's ridiculous. We have virtual care for diabetes. We have a virtual coaching app available for diabetes patients. They also get in-person coaching from their primary care, not in-person, I should say, virtual coaching from their PCP, their virtual PCP, and then $0 on select insulins and related supplies. We really think that we should get this as close to zero as possible. It's very important. I'm going to say the same thing about hypertension, so I won't repeat all of it again. But again, an AI-driven monitoring of your condition data is going to help you monitor yourself and make sure that you get your $0 select meds. It's very important. We think these are big deals because somebody's going to ask the question, who's my ideal patient? We don't know, to be honest. Is it the 25 to 45-year-old because they like digital things? Could be. It might be someone older with some chronic conditions as well. You know, our average age right now for our members, of the 50 that we have, is like 44. So it's across the board. So we mentioned earlier, we do have dental. We have an option to add to dental. The company is called HRI. They used to be known as Paramount Dental. They were bought by ProMedica. They're changing their name. We'll get you some, when I get those broker sheets and those sell sheets out that explains our dental, I'll make sure everyone gets it ASAP. We don't have them yet. They're in that legal process of changing their name. But we do have dental. And again, 100% preventative care coverage, 50% co-insurance for select basic major services. So it's your basic dental plan that you'll see around, but it's a good network, especially here in Ohio. It's a really good network, dental network here in Ohio.
Chris, is there a max out of pocket or a maximum allowance on that dental plan? Is it 1,000?
Brad, I don't know the answer top of my head. I'll have to wait till I get the sell sheet and I'll get them out to you. Yeah. Our sales team is on, and Ann is on, I think might be on as well, listening. Guys, if you know that answer and you can drop it in the chat, it'd be appreciated. I don't know it off the top of my head without digging out my information. Brad, I've given up trying to remember it all. I really have.
Okay. Well, I just made Ann a presenter, or one of the Anns. So Ann, if you're on and you know that answer, you can go ahead and blurt it out. You have 3 different logins, so I picked one of them.
Take your time, man. I'll cover for you.
Yeah.
I don't know.
And just type it into the message, into the question, Ann, and we can blurt it out. Or I will. I'm good at that. Carry on, Chris. Sorry.
No worries. So we have 8 to 10 slides here. I'm not going to go through all these slides. You guys will have this information, but I want to point out the important things. So first off, I want to actually thank Brad and Jeff for appointing us on in the ACA this year. We signed our contract this week. Until I get it back, I'm not going to say I'm on. It's kind of like I'm not going to touch the Stanley Cup until I win it. But we have a readiness meeting today with CMS, so we're feeling good. Fingers crossed. Praying hard. And what's the max for the dental plan? Do you know?
I am going to double check that. I know I've got it here handy, so give me just a moment.
Thank you. You can just drop it in the chat for everybody. That'd be great. Thank you, Brad. And thank you, Ann. So you'll see the plan here. So where I was going with this, first off, we're an ACA plan. Healthcare does have costs. We're not going to hide and say it doesn't. Matter of fact, Ann was nice enough. We flipped this around because last year was at the bottom. I was like, oh, you're hiding it. All the plans have an out-of-pocket deductible. All the plans have a max. That exists. Our goal, honestly, by using the features that you see here, $0 virtual care, discounted referrals, the mental health visits that are reduced, etc., we truly believe we don't want you to get there. If you're like me, and I used that story last year where I ended up in the ER and my best friend says you could have used your telehealth, saved yourself a couple $1,000s of visits, and you could have gone right and got your CAT scan and come back and gone to a specialist and skipped the ER. I probably could have. I didn't. We're going to work that way, but we're not going to tell you a fib. There are copays, there are deductibles. That's a reality. They exist. Now, again, the plans, Bronze Standard, Bronze Elite, Bronze Complete. They do exist, right? We have to offer the standard plan. That's a requirement. CMS, that's their name. that big gorilla in the room. We got a private message. I don't know how you check that. But here's your silver. Again, you'll see some of the differences. You'll see those deductibles come down. You'll see the same services, copays drop. Again, I'm not going to get this. But here comes the fun. Are you guys ready for the fun? CSR plans, overviews. And again, you'll see that those percentages change. So those cost share reduction plans, you'll see them again here, overview 2. And again, I don't want to insult you guys. You guys read these for a living. You know them. You'll look at them. You'll break them down. And your gold plans. Got to be honest. My gold plan might be expensive. It's fabulous coverage. Fabulous coverage. We're really excited about that. Just for those of you who aren't overly aggressive when you're reading SPCs, and we know members get this information, something you might want to share, we're required to list the bricks and mortar rates first. So obviously, we have to list that. We want to make sure that people understand there are things to look for and read into detail, or they'll miss it. That's what this is for, just a reminder for everybody. If you're talking to members and they like to look at their SPC, you want to make sure that they notice and read these things. It's important. Pharmacy benefits. So one of the changes we made from last year to this year, we've gone to Navitus as our PBM. Navitus is a nationwide pharmacy. We have an agreement with Walgreens. We did make a decision. CVS is not in. Walgreens meets network adequacy for the entire state. It also offered us the ability to drive lower rates and some more $0 prescriptions. So it was a business as well as a logistics decision. We also have a partnership with GoodRx that we'll provide to members so they can also get better pricing on different generic medications. There's a portal for members, and new this year, 90-day mail-in refills. So very excited for that. That wasn't offered last year, so this is exciting for us. These are your prescription drug tiers and costs. So again, I'm not going to read to you guys and insult you, but you can see this. Now, I will tell you, if I'm looking at, a bronze plan, even with an Antidote virtual visit, that's still $75. If you've got somebody who really wants their preferred brand and they're going to really think that that's what they want, this might be a great conversation to push them over into the silver and spend a few extra dollars a month, because $75, how many times they get the prescription, might save them some money. So it's just something to look at. I know you guys all do that, but it's just something that was called out actually yesterday in our presentation. So I want to share that information with you all. Obviously, you can see the CSRs are represented here on this slide as well. Here is your Silver Elite, again, your CSRs, Bronze Elites, and then here's your standard plan drug costs. So just everyone has them, they're here provided to you. New things for this year. So I mentioned this, that we made some changes. One, we're improving our web member portal online. Cleaner look, better to work with, easier to use. The app stays the app. We actually get great reviews on our app. The app is wonderful. 2 screens, you'll see we've got member information over here. If you look right here, there are things that you can review here. But here you can pay your bill, you can get your ID card, you can find a provider facility. All of those things are there. Speaking earlier, if your member wants to look up their network, they can do it off the app, or they can go to the web page. They can search a provider. There's a link. I'll share it with you guys as well. It's also on the broker page and in your portal, which we'll talk about. Member support. I believe Rose and her team are on. Rose, drop a chat. Say hello. Rose, I always say her name wrong, and I apologize, Rose. But Rose Camarillas is our customer success support lead. She and her team are always in the background. They're fabulous. They're 8 to 8. If you're thinking about Arizona, 5 to 5. They're fabulous. They also they also work very closely with our Antidote Health practice, helping coordinate visits and things of that nature. So they're wonderful. They're the ones helping us identify if a provider's not close by, can't get an appointment. They're helping us find those appointments and track and move you to those things. We're very excited there. What you guys want to know, this is about you as agents working with us directly. Obviously, we think there's some benefits in partnering. You get to deal with us and myself and Rose, Crystal and team. We're fun. Hang out with us. We love you guys. Our broker portal last year wasn't the easiest. It was easy to use. It was hard to get into, if I understand what everyone has told me. We're cleaning that up. Anyone who's appointed for next year already, you'll see that you have access to the new portal. You're not going to see a lot of functionality yet, and we'll talk about that in just a second. Obviously, we have ICHRA eligible plans. Our commissions and bonuses, I think we're going to be okay. And you'll see our daily support for brokers is 8 to midnight. We put that a little later because we know that you guys go home and you got your things to follow up on and you need a question answered. We're going to be there a little bit later in the evening for you. Enrollment tools. We will be on Health Sherpa this year when we go on exchange. So on exchange, we'll be on Health Sherpa. Off exchange continues to be through the Antidote Health portal. You can sign a member up on exchange. There's some discounting available if you go to our portal. So that member that does, so I understand this year, it's a pain in the butt to go to our portal versus using your one main streamlined portal. It really is. But if you have a member now who you see one of our plans makes sense to them and they're not getting us a subsidy, that might be that moment you go, give me a second, log into our portal directly and get them a little better rate. It's not huge. It's a slight percentage different. They're all different, so I can't sit here and say, oh, they're all 10 or 20 or 30%, but they're slightly different. I think that's important for you all to know. New for 2025. And I will, as I say this, please understand, we just made a change. Jeff Lang, I see your question. We'll be right back to it. We are building functionality as we go. So login access is granted now. You'll be able to, so if Jeff logs in, he'll be able to go in and see his portal. Not a lot there other than a cover screen right now that says we're building. Now, as November 1st comes, we're going to add functionality, searching the network, things of that nature. Before we get to January 1, book of business, all those different features that you see here are going to be there. And we did not have this available last year. This will be here this year. Co-brandable marketing flyers, trainings, and more and more and more. The functionality is going to grow, and over the next 6-8 months, you'll keep seeing that functionality grow on an agent and agency level. So Jeff Lang, we're going to talk about appointments, and I'll cover that for you in just a second. Your dashboard in the portal, we think it looks very, very clean, very easy. Obviously, we've modeled it after some others in the market. We've heard some folks say there are good things that we can use, so I think these are all be good. Your applications, Again, you'll be able to track your applications on the app, on the portal. Here's a big one: commissions, no change, $20. And if you're one of those agents who's got 6 or 8 with us, that renewal stays the same. I know it was a new year. I know there were concerns. We keep improving. Again, the 5 members per policy, everything stays the same. Commissions are what they are. We have not yet posted individual agent OEP bonuses. They will be coming out shortly. They'll be available on the portal very shortly. There will be bonuses. The upside for Ann and I, we sit in a very fabulous position that we hope will always be in. So Ann, my counterpart and chief marketing officer, we get to really evaluate what some others are doing in the market, and this year be able to say, hey, we want to be competitive in the market. It won't always be that way. We'll have to make decisions sooner. We'll have committees, but we're trying to be small, act small, be responsive to everybody in the market. How do you get appointed? So this is Jeff Lang asked the question in the chat. If anyone didn't see it, do you have to reappoint for this year? Yes, and there's two main reasons for that. One, actually there's probably 3 or 4, but one, we have to recertify you. We do that through Miramar. We also made a functional change in the broker agreement. We took commissions as being in the actual individual broker agreement. They're now posted on the portal. Because we made that change, legal says we have to have you do a new contract. CMS is actually leaning to that also. If you've paid attention to a lot of their anti-fraud, what do they use? That term they use, ghosting and individual nippers, and they want individual agents to be contracted. So we are going to do an annual reappointment, recontract process. If you were appointed with us last year, you'll notice it's a lot quicker. It literally takes you, as long as it takes you to read the agreement, as long as it takes you. I think there's a couple folks out there who've done it. I don't think it takes them very long. Very simple process. Cornerstone was given the new codes for this year. There are 2 codes, one for those agents who haven't worked with us in the past and those who have. So it's very important to make sure you do that. But an easy process. Those of you who have not used Miramar, this is the login page. If you've never logged into Miramar, you'll register as an agent. You'll be asked to put in your code. You put in your code, it takes you in. You then create your own Miramar agent login page, which takes you to this, your dashboard, which you register as a new program. If you have an existing account, you will actually log in and come right to your dashboard. You'll register a new program, which then you'll put in your code, and that will register you for the new program for this year. Obviously, we don't own the technology. So if you're having password issues, glitches, things of that nature, you're more than welcome to reach out to our team. We'll give you as much guidance as we can, but you're probably better served by using the knowledge base, which is right here. That's their help desk. That brings you to this page. It gives you a question. And most importantly, and I think what we found out is those people who've used Miramar in the past, changed organizations, changed your emails, haven't been in there in a long time, need to change your email. You do need to submit a ticket for that. There are some identifiers. You are asked to put in your social and your NIPR number. We don't control that. We're not going to do that for you. We don't want that breach of privacy. You need to do that yourself. That's just cleaner for all of us involved if you need to do that. And that's the appointment process. I hope that answered your question, Jeff. Key dates, we share this with you because, we think it's always important that everyone gets reminded about this every day. I'm sure you all know it, but this is important. I think the most important one here is anyone who enrolls after December 15th, their plan won't become live until February 1. So that's an important thing to remember. But everything before that, obviously, is January 1 start date. New for this year, how can your members pay? We can take ACH this year. We couldn't do that last year. Now we can.
Great.
Very exciting. We will take credit card payments, but they will be one-time payments only. There'll be no recurring credit card payments for health insurance. The CMS frowns on it. No one likes it. There's fees. It's just not optimal. But a member can set up recurring payments for their ACH.
Right, and of course, people lose their credit cards and,
all that stuff.
Their coverage gets canceled, so.
Rose and her team, this actually goes right to Rose and her team. They are able to help you make it up. If a member needs to make that phone call and dial in a payment, they can. and now we're taking mail-in payments as well.
Okay.
So there you have that. FAQs. Again, I'm not going to read these to you. I'll call a couple out that are important. We pay your commissions to Cornerstone. Cornerstone then reimburses you, pays you. We pay monthly. If you're missing anybody, reach out to your agency. They'll reach out to us. We share with them a report as we build function. So broker portal functionality. As we improve it, presently in the process, we'll keep doing what we're doing. Send you your monthly updates, get you your sheets, what's going on. But then as we move to the new year, that'll all go to the portal. So, but we'll make sure that's all working before we do that. Matter of fact, there'll probably be some duplicate for a few months. Our network, there is a login page. We'll show you where to look for the network providers. Our member support team, broker support team, we've talked about, they're here. We have no blackout period. Very important.
And what do you mean by that? Explain that.
So a lot of the plans actually say you can't write any business once you appoint for 25, you can't write any 24 business. If you're appointed with us for 24, you can write a business up to November 30th.
Okay.
That's available.
Mm-hmm.
We are not taking independent agent appointments. I shouldn't say we're not. We're discouraging it. Our issue is this. We're small. We're new. I don't really want to miss a $20 payment for that one agent who sold the plan. I'd rather have that go back to the agency, work with all of you directly through the agency, and get that extra added layer of support.
Right. Absolutely.
Makes sense.
Work on
Yep.
issues for you.
And here's your contact links. And again, Brad, to your one question, find the providers. You could click here. That takes you to the provider link, which takes you in Arizona to our proprietary provider lookup, or it would take you to QCP because we link to their webpage to look up the network. It's a little clunky. They're getting better, but you should know that. We do have VSP for pediatric care this year built into the plan. Delta for dental, we did, as we said, it's Insuring Smiles, it's HRI, which used to be the old Paramount. They have a link. It's all here, your broker support and your support for member support emails.
Yeah, that's Paramount, Ohio Paramount. Right?
Correct.
Toledo.
Exactly. And ProMedica bought them.
So
makes sense.
great coverage in Ohio.
Fabulous. So now we have time for questions. If anyone wants to chat them up, we're here. Love to answer them. We got a few minutes extra.
Yeah. Oh, great.
So just
Bring
real
them
quick,
on. Questions.
real quick, Ann did type in the dental coverage is $1,000 of dental coverage, and all the preventive is at no charge. Is the preventive, so this is a question, does the preventive count towards the 1,000, or is the 1,000 for sort of all of that basic level, so above preventive? Do you know, Chris?
I don't know without reading it. I'd have to get into the detail of the plan and read that EOC. I'll have to read it and get back to you on that.
Yeah, everybody asks it, right? Because what it would do is it would reduce the 1,000 by, say, $400 to $500. 100% basic. Okay, got it. Sorry, missed it. It went. Yeah, we'll guys, we'll get back to you on that. So yeah, that's good.
So Rachel Lipscomb, I see your question. Will the providers for 2020 remain the same? Obviously, provider networks are living, breathing animals. So yes and no. Some providers stay in the network, some go out. We're always trying to increase. We've actually employed a provider network development team in Ohio now, who we're actively trying to grow the network.
Can you please, Jeff, go back to the Ohio network slide that shows the QCP network, please?
Okay.
Because network's obviously a big deal, gang. That's, one of the, when you're shopping, it's meds and it's providers, right? Okay.
So I will tell you that, and I'm going to just go to the map in a second, but the market that I'm going to tell you that's really big for us this year and huge, and we're going to see significant cost sharing, savings, and availability of services is going to be Columbus, Franklin, Delaware. The Ohio State gave us, and we worked really hard to get a fabulous rate and provider rates for them, as well as Mount Carmel. We're really excited about that there, and our rates are extremely competitive. One of the questions from last night is, will our rates be competitive? You know, how do we think we look in the market? I recently shared a slide from our actuarial team. We reviewed it in detail here with the Cornerstone team because that was one of their leadership questions. We shared what we could share. We based our rates looking at last year's rates. And we would tell you that we believe in every rating area, we are second or third when it comes to rates in every market. We believe we'll be extremely competitive.
We're seeing some substantial increases from some carriers, so I think you're going to be looking pretty right on the first page.
But that's
on a lot of the
the only other piece I can tell you, those of you who know me, I'm available. Reach out and call me, ask me a question. Rose and her team, as I point, Rose and her team, they're awesome. They're available. If they don't know the answer, they're going to reach out to myself. And if I need to pull over and dig out an EOC to solve a question or solution for you, I will. You have my contact information. And Cornerstone now, just so you guys understand, one of the things I'm going to promote Cornerstone, one of the things they're doing today for you is I'll be training their internal team and their leadership team and their broker support team. So when you guys have questions and you call into here, they're going to be armed with more detail. Yeah. So that's exciting too.
That's great.
Yeah, just great. So gang, Northeast Ohio, Mercy Health, Akron Children's Hospital. I'm going to let you make your inference or association. I'm making the inference, you make the association about how Akron Children's Hospital is owned, okay? And then you'll know what I'm talking about. I'm trying.
And here's the service.
The 3-letter word or the 3-word acronym.
And then here's your service area again, folks. We're really excited. Hamilton and Butler are actually, they're going to be the Mercy systems here. A little bit of Mount Carmel sneaks down this way. We are presently looking at contracting with 2 other large groups in this area that we're talking to. We're very excited. Again, continually growing the network. We're also, I don't know if you guys can see my pointer, but this area, that these 3 counties that run the Indiana state line, is that the right state? I got my geography right. There's a network that we're working there of providers that we think will be a huge impact there.
Yeah, guys, you have the vast majority of our population covered in this footprint because you got Cincinnati, Dayton, Toledo, Columbus, Cleveland, and a ton of rural counties in between. So definite player.
We did some research here. I honestly think that we can win this. These 5 counties. I say win. I just mean we can get a lot of members out of there. And we're here to support you. I'm trying to think of questions from last evening. There was one question last night. We're new. We're not going away. How do I know that? Well, I don't. But how do I prevent that, and how do I make you and your member feel safe if we do go away? We have to have $65 million in escrow to cover our bills, our commissions, our claims, all of that, and your member would get an SCP opportunity because of loss of coverage. So I know that's a question that's going to come up. The member's going to say, why would I pick the new plan? I don't trust them. I had so-and-so and they left. There's new rules in place, and we had to prepare for them, right? And we had to set that aside and be able to do that. My favorite broker put a note on the board. Thank you very much, Joyce. I called you out because you called yourself out. She's the best. Reach out and tell us stuff. And I'm going to say this. Joyce has reached out and told me where we're good. She's told me where we're bad. And I'd really like to know all that information because we can't get better without having that relationship. And I want to tell you all on the call, do not hesitate to pick up the phone and tell us where we're falling behind or we're not doing it. I'm going to give you an honest answer, though, and tell you we're not the big organizations yet. We're not. We're trying hard to get there. We're committed to you and your members. We want to be here a long time. Customer service is extremely important to us. Delivery of care, patients getting better. That's what we're committed to. Affordable, available, and convenient.
Convenient.
That's what we want to be.
Yeah. And I think, guys, if you look in Northeast Ohio, I always have to call it out, but to our friends in Youngstown and in Canton and in Amish country, those counties are there. And we know in Wayne and Holmes County, access to care is not as easy. So a virtual model might be a great addition for the folks that reside in Wayne and Holmes and kind of western Stark County. So good stuff. Seneca County, Fremont area, good.
And I did want to make a point, and I'm looking at different trends in the marketplace, trends in general across America. Virtual care is the wave of the future. If you haven't tried it, do it. Virtual care has saved me so much time and effort and anxiety, particularly if you're coming down with, some illness or something like that. You just want a quick consult, a quick remedy to it. It's awesome. It's absolutely awesome. Virtual care is the wave of the future. So these guys are on the cutting edge of that, and that's my own testimonial.
Thank you, Jeff. I have one other thing to say to all of you. I know a bunch of you do local events. You do community events, recreation center events. If you need something, if you need somebody, let us know. We'll come set up a booth, a stand. We'll provide you some literature. We'll help you out with that. Just reach out. And I say that only because I know that I'm going to Arizona in 2 weeks to stand at some large church. I apologize, I don't know the name, but the broker set us up, and we're going to go. They've got a huge congregation. They've asked us to come and set up at their health fair. We're going to do that. We want to be part of the community. That's the piece I think everyone needs to hear. Antidote just doesn't want to be virtual care that exists out God knows where and where you're from. We want to be part of the community.
Fantastic. Fantastic. And we're going to wrap things up. One more question. Let's see.
So, hey, there's a fun statistic about Arizona. I just found it funny. Everybody kind of snickered. Go ahead, please, Chris, and say it, because it was just kind of interesting.
What was that? I missed it, Brad. I was reading Brittany's comments. I need to respond to Brittany.
The population size in those two counties compared to the state of Arizona.
Oh, I said that already. It's basically the state of Arizona. So, Brittany, there'll be brochures and things. We don't do a lot of that printed brochure stuff for your office, but if you need some, reach out to me directly, and we'll figure out what we can do to help you out.
Okay, Rachel, question about for appointment.
Does it start with Cornerstone?
Yes.
Yes.
Yes, we are your point of contact. So you'll reach out to Brad, and he'll get the ball rolling for you.
Yeah. Oh, and hey, there's a great comment. Brittany says she wears her Antidote T-shirt all the time. So. Well,
I hope to be able to do them again in the near future. I actually was working with my chief marketing officer yesterday to pick colors. Once we get an approval, we might see those around again. We're really excited, guys. I just want to thank everyone here at Cornerstone for your time. Thank you all for taking an hour out of your lives to learn about Antidote. Feel free to reach out whenever you want. We'll try and get back to you as quickly as possible. Thank you, everyone.
Thanks, everybody. Rachel.
Thanks, everybody.
All right, you got it. Take care, everybody. Have a great rest of your week.
Have a great day, everybody. See ya.
Thanks. Bye.